Our world is teeming with microscopic life forms, some beneficial and others harmful. Among the latter are bacteria and viruses, invisible entities capable of causing a range of illnesses. These infections, while sharing the commonality of originating from microorganisms, possess distinct characteristics that influence their behavior, the symptoms they elicit, and the treatments they respond to. Understanding these differences is not just an academic exercise. It's crucial for informed healthcare decisions. Misidentifying the source of an infection can lead to inappropriate treatment, potentially worsening the condition and contributing to antibiotic resistance, a growing global health concern. Imagine, for instance, treating a common cold, a viral infection with antibiotics meant for bacterial infections. Not only would this be ineffective, but it could also disrupt the body's natural balance of bacteria, paving the way for more resilient, drug-resistant strains to emerge. Therefore, equipping ourselves with the knowledge to distinguish between bacterial and viral infections is paramount for both personal well-being and the collective health of our communities. To effectively combat our microscopic foes, we must first understand their modus operandi. Bacteria, single-celled organisms found everywhere from soil and water to our own bodies, are remarkably self-sufficient. They can reproduce independently, possess their own DNA, and some even produce toxins that can make us ill. Viruses, on the other hand, are much smaller and far simpler in structure. Lacking the machinery for independent survival and replication, they are essentially intracellular parasites. Viruses invade the cells of a host organism, hijacking their cellular machinery to produce more viruses, and in the process, often damaging or destroying the host cell. This fundamental difference in their life cycles underpins the distinct approaches required to treat bacterial and viral infections. While bacteria can be targeted with antibiotics, drugs that interfere with bacterial growth and replication, viruses, with their reliance on host cells, present a trickier challenge. Antiviral medications, while effective against certain viruses, work by interfering with specific stages of the viral life cycle, such as attachment to host cells or viral replication. However, developing safe and effective antivirals is an ongoing challenge, and for many viral infections, treatment focuses on managing symptoms and supporting the body's natural immune response. While both bacterial and viral infections can manifest with similar symptoms like fever, cough, and fatigue, certain clues can help differentiate between the two. Bacterial infections, particularly those affecting the respiratory system like pneumonia or strep throat, often present with a higher fever, chills, and localized pain. Viral infections, on the other hand, tend to cause more generalized symptoms, including muscle aches, headache, and a runny nose. These differences, however, are not always clear-cut and should not be solely relied upon for diagnosis. Laboratory tests, such as blood tests or cultures, remain the gold standard for accurately identifying the culprit behind an infection. These tests can detect the presence of specific antibodies produced by the immune system in response to an infection or culture a sample to identify the specific bacteria or virus present. For instance, a strep throat swab can quickly confirm or rule out a bacterial infection, guiding appropriate treatment decisions. It's crucial to remember that self-diagnosis can be misleading and potentially dangerous. Seeking prompt medical attention at the first sign of illness is always recommended. The distinct nature of bacterial and viral infections necessitates different treatment strategies. Bacterial infections are typically tackled with antibiotics, powerful drugs that target and kill bacteria. These medications work by interfering with essential bacterial processes, such as cell wall synthesis or protein production. Antibiotics have revolutionized medicine, effectively treating a wide range of bacterial infections, from pneumonia and urinary tract infections to life-threatening sepsis. However, their overuse and misuse have fueled the rise of antibiotic resistance, a growing global health threat. Viruses, with their cunning ability to hijack our own cells, are more challenging to treat. Antiviral medications, while available for certain viruses like influenza and HIV, work by interfering with specific stages of the viral life cycle. These medications can reduce the severity and duration of illness, but often need to be administered early in the course of the infection to be most effective. For many viral infections, treatment focuses on alleviating symptoms and supporting the body's natural defenses. Rest, fluids, and over-the-counter medications to reduce fever and pain are often the mainstays of treatment. In some cases, antiviral medications may be prescribed, but their use is typically reserved for more severe or high-risk cases.